Keisha, your host. I'm so glad that you've tuned in for this episode as we continue to empower you into this 2018 journey into wellness. We have for you a spectacular episode today. Our topic is oral hygiene and dental health. So we have invited a special guest to share with us his expertise on that subject matter. Our special guest is from the Raleigh area. He's been a dentist for about 11 years now. He is loved by his staff, his patients, and I believe you'll become fond of him also. He owns Triumph Family Dentistry, and that's in Raleigh and in Cary. So that's 2 locations that he has to offer our community. So without further ado, I introduce to you and welcome Dr. Haydt. Dr. Haydt, thank you so much for joining us today. Thank you. My pleasure. So you've been a dentist for a while. Share with us what your motivation and passion in becoming a dentist has been.
Patients.
Yes.
Patients. I love helping patients. There's nothing more rewarding than that.
I love that, and I can actually agree with that. I love working with people as well as a physical therapist, and it does provide a lot of gratification when you're able to help people.
It does. It makes you feel justified. It makes you, it validates all the education you go through and everything. It really does.
Absolutely, absolutely. I agree. So you are the owner and the primary practitioner at Triumph Family Dentistry.
Yes.
2 locations, one in Cary and one in Raleigh, so it's convenient for so many people in the community. And you're favored by many people in the community. I've heard great things about you and your practice, and that you are very thorough in your practice.
Yes.
You provide great care and you educate all your patients, and hopefully they're all taking great care of their teeth.
Hopefully.
Yes. So share with us the variety of services you provide.
A lot. We're kind of a soup to nuts practice here. One of the things that I realized when I first got out of school is the more you can offer in the dental chair, the better for the patient.
Absolutely.
For instance, if you're to come in and I need to refer you somewhere and hand you a referral slip, a lot of times it gets lost in your purse, in the car, or 6 months later, still not done. So I spent a lot of time in post-grad education learning as many procedures as I can. So we do most of everything in our office. Wisdom tooth extractions, implants, veneers, cosmetic dentistry. Just finished up 8 veneers this morning, actually. Full mouth restorations, implant dentures, everything. Invisalign.
Wow.
We do a lot of Invisalign.
Okay. And you briefly touched on dentures. I'd like to get to know a little bit more in detail about bridges and dentures and when it may be indicated and beneficial for people.
Gotcha. Dentures, back when I was first out, making dentures and things, I realized that lower dentures really don't fit people. And they're hard because they lack the suction that a top plate does. So now what we do when we do dentures, we do a minimum of 2 implants with a denture.
Okay.
If a patient wants to go fully dentureless, get their teeth pulled and wants a denture down there. Just because, like you said, I don't want a patient coming back and handing the denture saying, I can't wear this thing.
Sure.
And so that's one of the things when we talk to patients is when they come in, they're looking for a full denture on the lower. I just tell them, look, if you want to go through this, I'm fine with it, but you have to have implants in order to hold this. I will be very upfront with them. And like I said, I never want to do a procedure and not have the patient like it at the end.
Right.
But that being said, most of the dentures that we do are implant retained dentures. And what they are, a denture can move in and out every night, but they actually snap onto the implants. And so it stabilizes them.
Okay.
So it allows them to eat more food, when you are talking, you don't worry about it coming out of your mouth. Those type of embarrassing moments.
Sure.
And
what about the comfort level?
Well, actually increase the comfort level because now it changes it from a completely tissue-borne denture, meaning it's just relying on the soft tissue as a suction and as its bracing agent to shift some of that to an implant. And so the implant actually retains it and actually stabilizes it. And also, pay for your viewers that have dentures, the top plate, the top denture, has that thick palate that goes all the way back and tends to cause patients a little bit of gagging. That's actually what the palate seal is. We get to remove all of that. We get to remove all of the palate, and we actually make a metal substructure in it, and so it looks more like a horseshoe, like a lower denture than and so that patients like that too, because it's room for your tongue. Food doesn't get, obviously trapped underneath it as much.
Interesting. Wow. I'll tell you, dentistry has advanced so much.
It has. And it's funny. I had a patient came in. He was he's 85. He was a dentist in Virginia at the VA for the longest time. And as kind of as a professional courtesy, he broke a couple teeth, and so I did some things on him just to show him how things are going.
Sure.
He told me he wanted to come out of retirement to come He said, "This is a lot better than the old amalgams I used to do." So it's advancing, and it's exciting because I get excited about talking about this because it's, patients, when a patient's looking for a dentist, and the patients out there looking, sometimes, it's tough to go somewhere where they know all of this, and so they know what to tell the patients and what options are, and, how to predictably perform the procedures. And so, we have some patients that will go to some offices and they'll say, they've never told me about implant retained dentures. The good news is, if you do have a denture, it can be converted to implant retained, which is nice. So there's always a progression of it. So the way I always talk to my patients is if they are in dentures existing, that's actually one of the easiest ways to start. I just say, look, if you are comfortable now, let's go ahead and place a couple implants. Let's make it implant retained. If you come to me in a couple of years and you say, look, I'm fine with this, but I don't want something that I want taken out. I want something fixed. All I have to do is place 1 or 2 more implants, and I can make something fixed from. So it's a pre-planning, so it's a progression.
Yeah.
So you don't have to go through the implant removal, new implants. It's just a couple more implants, and I can make something that is all porcelain that's screws. And in fact, I made something. Made one for my grandmother. She had nasal palatal cyst a long time ago, and honestly, I never knew she had a denture. An oral surgeon did a really good job back in the day, but she was always complaining that she couldn't eat potato pancakes.
And that's important.
Especially where you come from. So, so I made her a screw retained, it's kind of like a hybrid with porcelain on it, and she loves it. She says she can eat potato pancakes.
That's wonderful. I love pancakes too. They are good. Wow, interesting. I'm just intrigued because, I guess my knowledge has been from years and years ago. And so you've really enlightened me about all the advancements in dentistry.
Honestly, we just kind of touched the surface. There's so many more things that have come out or that are coming out. And what I find more and more that general dentists are learning more and more about implants, bone grafting. We have CT scanners in our office, so we can diagnose things better. It's better for the patient.
Absolutely.
And one of the things, when you start bringing in more people into treatment, you lose communication sometimes. And so one of the reasons why I like to place the majority of my own implants, and I don't place all of them, I have a very good referral team that I work with, that if things are a little complicated, that I work with, but I try to stay within those confinements of those couple specialists. But you want to make sure the implant's placed in a way that you can use it. And I ran into this problem. A guy came, he broke a tooth, didn't know where to go. He went to a specialist, not in this area, but he just placed the implant. Didn't think about where the restoration was going to be. And I almost couldn't restore the implant. And so obviously it made him pretty upset about it. And so that's, that was one of the validating moments of me learning as much as, taking as much class as I had to try to keep everything there, because it's better for the patient. It's nice to have everything done predictably.
Absolutely.
But then it comes with a lot of work. You have to spend a lot of time, a lot of education into it. So.
A lot of education. Absolutely. That's understandable. So let's talk about TMJ, temporomandibular joint area, which is the area on the side of your face where your mandible and the side of your temporal bone actually connect to form a joint. So it's estimated that over 10 million people have temporomandibular joint pain, or TMJ is what we call it for short to make it easier. And as physical therapists, I have actually treated quite a few people with TMJ.
Yeah, I'm sure you have.
And received quite a few referrals from dentists. And a lot of times it is a team effort.
It is. It absolutely is a team effort.
Yes, which is great.
It's a neuromuscular neuromuscular joint, so it actually is a team effort. You know, on our end, we make devices that can help.
Okay.
But we do a small part. On your end, you guys do a very large part in that,
Sure.
because if you don't change the patient's habits,
Absolutely.
and actually what we're finding is kind of as things progress here, the devices we are making actually inadvertently help a little bit with sleep apnea, and a lot of that is tied together.
Yes.
And so what we're finding now, we treat sleep apnea in our office, and the reason why we started treating it, and I was reading literature on it, and we were actually making devices that kind of help the mandible stay in a position that the mandibular advancement device works with sleep apnea.
Interesting.
And so it was kind of a natural progression of things. And so we realized that patients that do have sleep apnea tend to have a lot of TMJ problems.
Yes.
Headaches, things
Yes.
like that. And like I said, with some of the devices we were making, we were kind of inadvertently helping with their sleep apnea, and then so it's kind of the next evolution of things. But normally we see them at our office, and a lot of times it boils down to really two things. It's a muscle problem or it's a joint problem.
Yes.
And there's two,
Sometimes both.
or sometimes muscle is a joint problem, exactly. But normally, we see a progression of a patient just saying, hey, I woke up this morning, I can really can't open my mouth that much, or to a patient that, we just sent to UNC to have their TMJ scoped. So it progresses, and I love to catch it when they're young.
Absolutely.
Grad students, I see a lot of NC State grad students. And I wore one when I was in dental school in a stressful time, and I love catching them there because I can tell them, look, this is a muscle problem.
Right.
This is easy to fix.
It's easy to fix, yes.
Exactly.
When you catch it early.
With this little bite splint, they'll be fine.
Yes.
You're going to see a physical therapist. They're going to work with you through your posturing.
Stress management. We do a lot of relaxation techniques.
That's right.
I educate because a lot of times I'll also have headaches, pain in the neck, facial pain. So a lot of education with that. Of course, we provide exercises as indicated. We do a lot of manipulation, manual treatments with them, and then also dry needling. Sometimes
I've heard
some
that
of
a lot,
our clients have responded very well
That's
to
great.
dry needling. So yes, absolutely.
No, it's it's something we treat a lot of, and like I said, it's not getting back to it. It's on a case by case basis.
It is.
So we do a full diagnosis of your temporomandibular joint, and it's when patients come in, we try to educate them on TMD and talk to them about what we're finding, anterior disc displacement, reductions, what muscles they're using. A lot of patients come in and say, well, my joint's fine, but this muscle hurts, and then we have to educate them on what that muscle is and why they might have trouble neck pain when they wake up.
Right.
And things like that. We're kind of the ones that see them at first, and then it is absolutely team effort. We can make the device, but if they're not practicing with the device and they're not using the device, or if they're keeping the same type of posture and stress management, then that's where you guys come in, and it's not going to help.
Absolutely.
So I always tell patients, never want to put a Band-Aid on a problem.
No, no, because it can progress.
Oh,
It
absolutely.
can progressively get worse. And I always tell my clients is that it's always best to treat an area of concern within the first few days or weeks that it's occurring, because then we can actually turn it around.
Exactly.
And you won't have that condition for a long period of time. We can get that treated for you, get you educated, get you taken care of so that you can feel good and not have any problems being able to talk, being able to chew, being able to open and close your mouth.
Yawn.
And yawn. Those simple things that we take for granted every day, right?
Oh, you're right. You're absolutely right.
So,
Well, no, it is a game changer in dentistry. And what I'm noticing now, and 10 years ago when I was telling my friends about it or colleagues about it, everyone's kind of skeptical about it. And a lot of older dentists and things saying, the margins are bad, but they're only as good as you make them. And
Sure.
so, with it now, everyone's catching on, and so people are starting to do it more.
sure.
And so it's a lot better for the patients. Now, veneers, for instance, I had a lady that came in, she broke 8 and 9, and she had restorations on 7 and 10, which are the front 4 teeth. She wanted to get the veneers done, but she was leaving for a cruise in 4 days. Well, she was able to come spend 4 hours with me. I did all 4 veneers, and she was fine.
Oh, wow.
When she walked out, she had a veneer this morning. That's a minor preparation to the tooth. Does alter the tooth, but it's a minor preparation, stays in enamel. It's a very strong veneer. And then there's some that we have to do kind of larger prep veneers for patients that are kind of on the yellower side of teeth, but want a whiter smile. We have to prep the tooth back a little bit to allow the lab to add a little porcelain there.
Interesting.
So it's, a lot of the stuff that we're talking about is not open and shut. It's not as easy as there's a lot of thought behind it. And that's one of the things is doing as many as we do through our office, you realize that there's more to it than just prepping a tooth and throwing everything out there. There's a lot of thought process, a lot of pre-op work that goes before it, models, pictures, patient's expectations.
Sure.
The last thing you want to do is get done with something, the patient look and say, I'm not happy.
Absolutely.
That's a
because
good
that's
approach.
time and that's money. So.
Well, I mean, it's just a blow to you.
Yes.
You work really hard. I mean, we
Absolutely.
for the 8 veneers we did this morning, it was tough. It was tough.
Absolutely.
But when the patient gets done, there's nothing more rewarding than the patient smiling and saying, I love them.
Absolutely. You want patients to be happy.
Oh, absolutely. That's
and
the reason why we're doing this, right? Yeah.
Share with us the preventative daily care that everyone is encouraged to do.
Brushing and flossing. Flossing at least once a day. There's all kinds of floss out there. You know, the standard of the way my hygienist like to tell you is use the floss you wrap around your fingers, and there's also something called Listerine has a floss pick that's out, and I love it. Small mouth, little finger, so it's tough for me to help it back there. I love it. It's not as good as it, but it still works. Brushing and flossing every day is the standard. It always has been, and it's amazing if you take 2 minutes in the morning, 2 minutes at night, 1 minute of flossing. It's 5 minutes out of your day, and it's
goes a long way.
It goes a long way.
Absolutely, absolutely.
If you ask my 12-year-old patients, they're very busy and they don't have
time. I can attest to that, but it's so important because from what I understand also is, of course, your mouth is the largest area where bacteria can enter and cause a lot of other medical conditions.
Absolutely. When we think you breathe through your mouth, everything is coming in through your mouth. You're supposed to be breathing through your nose, so everything is filtered, but a lot of people breathe through the mouth. You're running, you're outside, you get, gasp for breath. So all of that is entering into your body, and then also everything you eat.
Yes.
Smokers, drinkers, things like that. So.
Yeah. Some of the signs of those conditions, as well as
one of the most common signs or complaints we hear with patients that their tissue bleeds when they floss, so they stop, and that's us telling them, when they come in, that it shouldn't bleed.
Right.
The more you do it, the less it will stop.
Right. Okay.
The more it will stop. Sorry.
Okay. So that makes sense. Okay. So when flossing, if you're noticing bleeding, that's when it's time to be concerned and contact you. We've got to get it taken care of. Yes, absolutely. Now, and what if we do not take care of it and we just avoid it? What are the consequences?
Well, the end consequence could be the patients I'm treating now that are fully edentulous, that don't have teeth or they couldn't save their teeth. So now we're talking about full mouth reconstructions through implants, either through an implant retained denture or a fixed prosthetic. So you're talking about losing your teeth, and you're also talking about quite a bit of money trying to replace it. It's a lot cheaper. We tell our patients all the time, it's a lot cheaper and a lot easier to keep your teeth.
Preventative measures, yes. Maintenance is important, very important. Monumentally important. And, sometimes I think, I wish we were like sharks. Sharks, their teeth get replaced, right? But humans, when we get our adult teeth, that's it. So you get one chance when you become an adult, you have your adult teeth, and that's it. They don't replace.
We see kids, we call them their first set teeth, their practice teeth.
They're practice. Yes. But when you become adult, when you get your adult teeth, make sure you're definitely taking care of them. So that's good that you see from children all the way up. So you can get them in that pattern of course, flossing, brushing their teeth, and that is really important for their future care of their teeth and maintaining their teeth. Well, since we're on that topic of brushing and flossing, I want to add some interest to it. Flossing and water picks. Similar benefits, or is it different?
They go hand in hand.
Okay.
So a water flosser will do its job, and the floss will do its job.
Okay.
So for instance, a water flosser will not get into any contact with teeth, and that's where we see a lot of the cavities forming.
Got it.
But a water flosser will get better into the gingival sulcus. So we tell patients to use both.
Okay.
A water pick is a great device. In fact, once we turn a patient onto it, it's almost addiction because they realize what I always tell patients is go out to dinner, don't floss after you get back, don't use a toothpick, and then use your water flosser and see what comes out.
Ah, okay, interesting.
That's an eye-opening experience to patients, and then they start getting addicted to it because they know what's in there.
Right, and I know by any means it does not replace, of course, going to the dentist, but do you get that same feeling after using the water pick as when you go to the dentist and your teeth feel like sparkling clean?
That's right, well you maintain it. So
okay.
for instance, if you were to come in and see me this morning and then use your water pick and use your water pick the next day, it would elongate that clean
Okay, interesting, because I love that. You know, right after I go to the dentist, I do not want to eat anything.
Well, it is a relief. I mean, you got something taken care of. So
yeah.
It's absolute relief. You're exactly right.
Absolutely.
It's like kind of going to your general practitioner and you have to tell them you have good cholesterol.
Right. Exactly. That's a good point. And differences between a manual toothbrush and an electric toothbrush, can you share with us?
Huge differences. Yes, if you don't have a Sonicare or an Oral-B, you should definitely have one.
Okay.
Different than a manual toothbrush. So basically, a manual toothbrush, you're using, your own motions to try to clean your teeth. With a Sonicare, it's doing it for you. You just move it along.
Sure. Okay. So it's doing the work. You just have to actually motion into practice.
Yes, exactly. You just got to move it and it takes care of it. Yeah, but it's something I recommend for all of our patients. Now there's a lot out there, Sonicare, Oral-B, and honestly, they both work the same, no matter what commercial you see.
Sure.
The problem is some will fit in certain parts of the mouth if you have a smaller mouth. Sonicare is better for smaller mouths. Oral-B is better if you have a larger mouth, so you can get back to all your teeth.
That makes sense. Okay. And so hence, take good care of your mouth. Make sure the bacteria is all gone. So it doesn't be a precursor to a lot of the medical conditions.
Sure.
Thank you for sharing that about oral practice and hygiene. That's very important, so thank you for sharing that. Wow, interesting. I'm just intrigued because, I guess my knowledge has been from years and years ago.
Yeah.
And so you've really enlightened me about all the advancements in dentistry.
Honestly, we just kind of touched the surface. There's so many more things that
Sure.
have come out or that are coming out. And what I find more and more are that general dentists are learning more and more about
Sure.
implants, bone grafting. We have CT scanners in our office, so we can diagnose things better. It's better for the patient.
Absolutely.
And one of the things, when you start bringing in more people into treatment, you lose communication sometimes. And so one of the reasons why I like to place the majority of my own implants, and I don't place all of them, I have a very good referral team that I work with, that if things are a little complicated, that I work with, but I try to stay within those confinements of those couple specialists. But you want to make sure the implant's placed in a way that you can use it. And I ran into this problem. A guy came, he broke a tooth, didn't know where to go. He went to a specialist, not in this area, but he just placed the implant. Didn't think about where the restoration was going to be. And I almost couldn't restore the implant.
Oh, wow.
And so obviously it made him pretty upset about it. And so that's, that was one of the validating moments of me learning as much as, taking as much class as I have to try to keep everything there, because it's better for the patient. It's nice to have everything done predictably.
Absolutely.
But then it comes with a lot of work. You have to
Yes.
put a lot of time, a lot of education into it. So.
A lot of education. Absolutely. Absolutely. That's understandable. So yes, very, very important. Dr. Haydt, you've been wonderful. You've enlightened me. I know you've enlightened our viewers. And see, I told you you're going to be fond of him as well. You provided us so much information about dental care, oral care and hygiene, TMJ, as we talked about, so many others. It's good to know there are options now, and I think maybe some people just don't know that there are options. But if you need a good dentist, we have one here for you, Dr. Haydt. He's at Tryon Family Dentistry. Again, he has a location in Cary and in Raleigh. Very convenient locations, near the highways, near the main streets. You can get to him. He's wonderful.
Great, and we have one coming in Eastern North Carolina too.
Oh, in Eastern North Carolina. So
Zebulon.
soon you'll have 3 locations, Zebulon. So that'll be very, very convenient. And I love his office. Beautiful office. Very comfortable. His staff is wonderful too. So I know you're going to love it when you come and visit Dr. Haydt. So thank you so much, Dr. Haydt. You've been wonderful. And I look forward to getting all the great comments and just the reviews that people share.
Good.
Since they've seen you, I've seen a lot of your reviews, and they've been 5-star. They've been great. So we appreciate all that you're doing in the community, all that you're doing helping people from children age all the way to adult ages and elderly as well. So we appreciate all that you do, and we thank you for being here.
Thanks for having me.
Absolutely. So we thank you for joining us again on the Wellness Show. Again, just a topic to make sure that you are empowered, encouraged, and well educated on your way to having good oral hygiene as well as dental care. Thank you for joining the Wellness Show again. And as always, we wish you well, and we look forward to you joining us on our next episode.